बिस्मिल्लाहिर्रहमानिर्रहीम। शुरू करता हूँ अल्लाह के नाम से जो बड़ा मेहरबान निहायत रहम करने वाला है। टुडे वी विल डिस्कस अबाउट द डेवलपमेंट ऑफ द टंग। अब जो ये क्या है, यूएसएमएलई का मोस्ट इंपॉर्टेंट है कि डेवलपमेंट ऑफ टंग कैसे होती है। सबसे पहले हम देखेंगे जो आर्च वन है, दिस इज मेनली फॉर्मिंग इंटीरियर टू थर्ड ऑफ द टंग। फर्स्ट pharyngeal arch is mainly involve the two-third of the tongue. Now, third and fourth pharyngeal arch mainly posterior one-third of the tongue. Third and fourth pharyngeal arches mainly forming the posterior one-third of the tongue. And the most important, posterior one-third of the tongue and interior one-third of the tongue, they are separated by the sulcus terminalis. This is the sulcus terminalis, and this is the foramen cecum, and for behind the foramen cecum is the posterior one-third of the tongue. I will be discussing with you is the most important in the development of the tongue is that of the taste sensation and the sensation of the pain and the motor fiber. This is mainly formation of the taste and this is the sensation. Now our concern is the interior two-third of the tongue. This is forming the, I will be discussing with you is the interior two-third of the tongue I will be discussed. In case of the interior two-third of the tongue, this is the cranial nerve 7, which is the facial nerve. And taste sensation in the posterior and mainly formation of 9 and 10. 9 and 10. That's why 7, 9 and 10, these are involving the taste sensation. Interior two-third of the tongue by the cranial nerve 7, then the posterior one-third by the 9 and 10 by the lastly 10. This is the vagus nerve. That's why the taste sensation is mainly important in the cranial nerve number 7, 9 and 10 by the solitary nucleus. That's the most important about the taste sensation. Now our concern is mainly the sensation of pain fiber. And pain fiber interior two-third of the tongue by the cranial nerve number 5 and its branch V3. V3 mean V1 is the trigeminal, this is the trigeminal nerve and ophthalmic, maxillary and mandibular. V3 is the mandibular branch that mainly interior two-third of the tongue. And this is the 9 and 10. And these are the I will be discuss with you is the most important. If you remember, अगर आपने याद रखना है तो इसको इस तरह से है कि posterior जो two-third है उसमें यह देखेंगे अगर टेस्ट की है चाहे सेंसेशन की है सेम नर्व्स हैं, सेम नर्व्स टेस्ट की हूं चाहे सेंसेशन की हूं, these are the 9 and 10. बट इंटीरियर two-third में ये क्रेनियल नंबर 7 जो होगी वो टेस्ट की होगी और जो 5 होगी वो पेन की होगी. That we all discuss about the sensation and taste fiber. Now our most concern is the motor innervation. Motor innervation mainly these muscles are present. I will be discuss with you is the muscles of the tongue. In this case, muscles of the tongue are present, and in this scenario, I will be discuss with you is the other muscles which are the hypoglossus muscles. यानी कि इसमें कौन से होते हैं, जीनियोग्लोसस, स्टाइलोग्लोसस है, हाइपोग्लोसस है. That's why cranial nerve number 12 I will be discuss you with you is the cranial nerve number 12, which is the hypoglossus nerve, and these supplying all the muscles of the tongue. But exception is the palatoglossus. Exception is the palatoglossus, and palatoglossus is the most important MCQs. It is innervated by the 10th nerve. MCQs. In case of the MCQs point, palatoglossus is platanoglossus. This is a 10, and if you remember palatoglossus, it is supplied by the 10th nerve. That's why motor innervation is important. All the types of the muscles of the tongue are supplied by the 12th nerve. This is the hypoglossus nerve. But in the case of the palatoglossus, which is the exception, it is supplied by the cranial nerve number 10. That's why we have all the discussion of the tongue development. This is the interior two-third first arch, posterior two-third third and fourth arch. Then we will discuss about the taste fibers, and other is the sensory fiber, pain fiber, sensation of the pain. Posterior two-thirds is supplied by the same nerves. Anterior two-thirds are supplied by the different nerves. And motor innervation is mainly by the cranial nerve number 12, which is the hypoglossus nerve. But the most important is the, sorry, this is the glossopharyngeal nerve, and mainly supply, this is the most important, and but the cranial nerve number 10, which is the exception, it is supplied to the palatoglossus. The most important question ever, इसमें सबसे पहले दो क्वेश्चन आते हैं कि भाई ये एक तो इंटीरियर टू थर्ड वाला आता है कि भाई इसको टेस्ट को 7 करती है, और जो 5 है वो पेन सेंसेशन है, और दूसरा एक एक्सेप्शन, ऑलवेज यू रिमेंबर द एक्सेप्शन दैट क्रेनियल नर्व नंबर 10 सप्लाई द प्लेटोग्लॉसस मसल. Thank you so much. We have all discussed about the tongue development. Thank you so much. Jazakallah, Allah Hafiz. Please like and subscribe our channel Medicose Viewer, and remember us in your prayers. Allah Hafiz.